We've been working on myeloma in our lab for a few years now, and one of our focus is the use of patient-derived plasma cells, which are hard to use for longer extended periods of time in the lab. And we've developed a hydrogel model based on pure matrix hydrogel, in which we culture plasma cells. So initially myeloma plasma cells, and based on the clinical work from Monique Minema, the professor of our lab, we decided to extend the work on myeloma to AL amyloidosis. And that comes with its own challenges. So there's a smaller clone of plasma cells, there's a lower proliferation index, but the work that we're presenting here at the ISA, we managed to demonstrate that it's feasible to culture AL plasma cells for a week using our hydrogel model. So if you compare the surviving plasma cells after 7 days in culture, we see an increase in the number of plasma cells when we use the hydrogel compared to 2D conventional cultures. And also we add pro-survival cytokines, IL-6 and APRIL, and these were shown to benefit myeloma plasma cells previously. And by adding the cytokines, there's no need anymore to use stromal cells or other cells that keep the plasma cells alive. So we just add the cytokines, which makes the model robust, easy to use, very reproducible. So we were wondering, do the AL plasma cells also benefit from adding those cytokines? Short answer, yes, they do. So we demonstrated if we add both IL-6 and APRIL at the same time, there's an increased survival of the plasma cells. So we use the hydrogel, we use the cytokines, and then we have this model. And then we can do interesting stuff. So for myeloma, we've been adding IMiDs, conventional chemotherapy, daratumumab, BCMA inhibitors, all kinds of stuff, which allows us to characterize the response to all those different drugs and see how the plasma cells are reacting. So obviously we were interested to do the same stuff in AL. And at the ISA we're presenting some of the work on Venetoclax, a BCL2 inhibitor, which was shown to be beneficial, especially in translocation 11-14 positive AL patients. But the background of the response to Venetoclax is not entirely clear. Is it related to the BCL2 expression, or are MCL1 and BCL-XL involved? So we also measured intracellular expression of BCL2, BCL-XL, and tried to relate the response to Venetoclax to those intracellular protein expressions and to the translocation 11-14 status. And while we do see a clear difference in response to Venetoclax in vitro between translocation 11-14 positive and negative in myeloma, we failed to demonstrate the same clear difference for AL. There's a small difference, the cohort is not that big yet, but the initial results demonstrate that the results are very close to each other. Yeah. So the characterization of the response to Venetoclax is ongoing. We're trying to extend it to other proteins, maybe include RNA-seq data. And also the work on Venetoclax serves as an example of an application of what we are able to do with our hydrogel models.